At Temecula Valley Hospital, we're lucky enough to be able to offer all kinds of cardiac services. Overall, I've been so excited about the hospital and about the progress that we've made here at the hospital. I can tell you, just having a hospital in town in Temecula that is fully capable of doing everything we can for patients will make a huge difference, and has made a huge difference for a lot of patients in the area already. Recently, we've been able to add another device that can help these really sick patients who have heart attacks. The device is called an Impella Catheter, and patients who come in who have these really severe heart attacks that need some kind of support for their heart function as they make it through and to be able to survive in the first 24 hours, this catheter will be able to do that. And so we've used the Impella Catheter at Temecula Valley Hospital recently very successfully. Our patient has done really well who had the Impella Catheter, and she's now home and feeling healthy and walking around and spending a lot of time with her family.
We received STEMI accreditation back of last year, about a year or so. What that stands for is ST elevation myocardial infarction. It's a big long word for heart attack. Some of the other areas of our cardiac program is cardiac CT. We've done over 100 cardiac CTs, and what that is we can actually do a CT scan of your heart and do 3D imagery and actually turn the heart with 3D, which allows us to see any kind of blockage in your heart that would prevent us from actually going in surgically to do that. So we call it minimally invasive. We would start an IV on you and then we would do the study. That's a big help for a lot of the cardiologists in this county. They utilize us quite a bit for that. I have techs specially trained as well. They had to go through 3 months of schooling to learn that. One of the other areas we have in cardiology is our Echo 3D technology. What that is that's ultrasounds of the heart. Again, 3D, we get in, we scan the heart, we spin the imagery, we can see any kind of blockages in the heart. Another area we have in cardiac is Treadmill, which is the unit you see behind me. We've recently received approval from the California state to use our Treadmill system. So what we have here is what we call a heart stress test. You come in and you walk on the treadmill. We give you some medications that may excite your heart a little bit, and we try to see dysrhythmias of the heart, abnormalities of the heart. Another way we have with heart stress tests is what we call chemical stress test, where we actually lay you in a bed and we inject you with the stress material. It makes your heart beat faster. We look for abnormalities in that way. So we have a full range of cardiac in this facility. We also do something called Holter monitors, where we put you on an event monitor. You can go home with it, you sleep with it, you brush your teeth with it, and you come back in 24 to 48 hours later, and we measure all those rhythms that you have to make sure you don't have a dysrhythmia. All of these programs that we have here at Temecula Valley Hospital is what puts us in the forefront for cardiac services.
We have the best cath lab in town. Our cath labs have the best cameras, and also I've made sure that we stock the cath lab with all the stents, balloons, and stuff like that. And with all these technologies together in one hospital, not only can we diagnose the most critical of the heart diagnosis, but also we can treat any kind of heart patients, from the minor patients who come in with chest pain to really the sickest of the sick patients who have these severe heart attacks. Sometimes when patients are just so sick, they have a big heart attack. And us being here so close, I think we are in the right place, and we'll be in the right place at the right time to take care of these patients who otherwise would never have survived en route to these other facilities. If I had a family member that had a heart condition, I would not hesitate once to certainly send my family member to Temecula Valley Hospital.